Health and Wellness presented by the Far Northern Regional Center's clinical team. My name is Nellie Camarena, and I'm one of the registered nurses, and I work in the Chico office. And it's my pleasure to introduce to you other members of the clinical team. I'm not sure if Dr. Austin is on. If not, we do have Jen Badger, who's our FNRC nurse in the Reading office. Hi, Jen. Thank you. It's, again, really nice to have you all here today, and I hope you find the information presented today useful and the day-to-day care of the regional center clients. As you know, our classes cover a variety of health-related topics, and today we will be finishing off a 5-part series on the Fatal 5. So if you've been with us the last several months, you know that we've covered different topics, including bowel obstruction, aspiration, dehydration, seizures, and today we'll be going over sepsis. So we'll go ahead and get started here. So here we go. So you may recall, if you've joined us in previous calls, you know, when we talk about the Fatal 5, it refers to the top 5 disorders linked to preventable deaths in individuals with developmental disabilities. While the issues can differ in order of frequency, the 5 conditions most likely to result in death or health deterioration for persons with intellectual and developmental disabilities include the ones, you know, what we just talked about: bowel obstruction, aspiration, dehydration, seizure, and sepsis. Last month we went over seizures, and today we'll be going over sepsis. So what is sepsis? I am going to launch a really quick poll up here. So feel free, if you're able to, go ahead and participate. It's just clicking, you know, what you think the correct answer is to this question. And I'll give it a few seconds to give everyone time to log in their answer and the response. Okay. So I'm going to share the results and then we'll talk about it. So yes, the majority of you answered. It's the body's extreme life-threatening response to an infection, which is the correct answer. It's a life-threatening medical emergency. So sepsis, you'll learn as we go and continue to talk about it during today's call. It happens when an infection you already have triggers a chain reaction throughout your body. A lot of infections that lead to sepsis most often start in the lung, urinary tract, skin, or GI tract. Without timely treatment, sepsis can rapidly lead to tissue damage, organ failure, and death. So it is our hope today to kind of give you a refresher of what this is and how it really does impact our clients and ways that we can be more proactive when it comes to caring for them. So on the next slide, I'm just going to show a really quick video that gives an overview on this. Let me make sure I have it on. Let me know if you cannot hear this.
Sepsis, formerly called blood poisoning, is usually triggered by a local infection, such as pneumonia in the lungs, an infected wound, or infection of the urinary tract. Should bacteria from the local infection spread or secrete toxic substances into the bloodstream, the immune system may sometimes go into overdrive, causing inflammation throughout the entire body. You get sepsis. This interferes with the blood flow, which leads to a drop in blood pressure, making it difficult for the blood to carry oxygen to the body's major organs. This can lead to failure of organs such as the lungs, the kidneys, or the heart. In the worst cases, the patient dies in a matter of hours. Detecting sepsis early is crucial, so be attentive to symptoms such as fever and chills, breathing difficulties, diarrhea and vomiting, confusion and slurred speech, low blood pressure and elevated heart rate, low urine production. Sepsis can affect anyone. Help us stop sepsis.
Okay. Go ahead and stop that. And exit out of here. Okay, so before we jump into what exactly happens when someone has sepsis, I think it's a good time to do a quick refresher of what, a normal immune response looks like. So we all know that anytime, bacteria or other microbes enter the body, our immune system is efficiently able to destroy, these invaders. And a cause of infection, the body's immune response is self-limiting. So, the immune forces are called into action. They do what they need to do to, combat the bacteria or virus or whatever it is. And then those immune forces retire, so to speak. However, sometimes the normal response to serious illness and injury is to initiate an inflammatory response, but we'll talk about later where that kind of goes into overdrive. So I'm sure you can all think of a time when you may have like cut or injured your finger, for an example. You probably experienced some swelling, redness, warmth, and even some pain in the area. So in this case, the inflammatory response was able to increase the amount of blood flow to the site of the injury to get more nutrients in the white blood cells to help, combat the, if there's any bacteria in there, to help make sure that it doesn't spread anywhere else. So when all of this happens, the blood vessels need to get wider and dilate to allow more white blood cells to arrive at the scene. And sometimes what happens as well is that the blood vessels in the inflamed area get leaky, so to speak. And this leakiness allows the helpful white blood cells to enter the tissue and help identify the invading pathogens. And then sometimes you'll see some swelling because of that, and it causes more water to go to that area. And so you see that like with a cut, you'll see the inflammation. So it's important, right, that all of those mechanisms are important to the wound healing because it helps control the bleeding and the prevention of infection. However, where we get into trouble is when this immune response becomes amplified and dysfunctional. So it leads to an imbalance between pro-inflammatory and anti-inflammatory responses, which we'll talk about in the next slide. So, sepsis, it's a complicated thing. So I'm trying to simplify it in ways that, to understand really what it is that's going on. So I like I mentioned in the previous slide, normally when there's an infection or something that goes on, the inflammatory reaction should, remain localized to that area. But a septic reaction is when it travels via the vascular system to spread inflammation throughout the whole body. So the immune system goes into overdrive, and the chemicals it releases into the blood to combat the infection triggers widespread inflammation. And then just please note that when we talk about sepsis, it's typically not something that's just going to arise on its own. It stems from another medical condition that we'll talk about later on. So it could be trauma, major surgery, infection, a pneumonia, UTI, a skin infection, someone who has, appendicitis, or, just in any part of the body, or even sometimes it's like an invasive medical procedure, such as, insertion of like a catheter or something like that can introduce bacteria. So that's usually how it arises. But for a local infection to progress to sepsis kind of also depends on the situation, the source and the location. For example, a pulmonary or an abdominal infection a lot of times has a higher chance of developing into sepsis than something else. The most common sites of infection that can lead to sepsis are lungs, abdomen, kidney, or an infection in the bloodstream, which again, we'll talk about later on in this presentation. So obviously not most infections don't trigger a septic reaction, right? Like that example of the cut, that doesn't necessarily mean it's going to turn into something like this. But, and also there's different factors that play a role. So two people can have this, same infection in the same tissue caused by the same bacteria, but one person might develop sepsis and the other may not. So it may depend. It'll depend on the type of tissue, the type of bacteria, and a patient's, medical history, right? An individual that has like poor nutrition intake or someone who smokes daily may make them more compromised in these types of situations as their body's ability to fight infection decreases. So there's a lot of factors that play their role into this. So, with sepsis, it typically begins like a typical infection. So sometimes you might not even know, that a client might be leading toward becoming septic, because a lot of the times the infections and the symptoms that they have are all very similar to what's on this slide. So it'll present like a classic systemic infection, right? They might have a fever, a high heart rate, fast breathing, however, in this situation, instead of tapering off and disappearing, the inflammatory forces then spread beyond the infected region. Some individuals may have a fever and might have an abrupt onset, but, there might be other individuals like elderly patients who may not develop fevers, because a lot of the times they don't readily develop one. Once you get older, it's harder to detect. And so there's just different things to keep an eye out. But at any time, if you see anyone that has, confusion, especially if they've, been kind of undergoing treatment for like a UTI, for example, or you suspect that they might have UTI, that's why it's important to get them checked right away, because you just don't know how they might develop. So if someone who does have sepsis, if it's not addressed rapidly, it can progress to what's called severe sepsis. So this occurs when, in addition to the signs of sepsis, there are now signs of organ dysfunction. What occurs in this stage is that now we have leakage from the blood vessel linings, much like a water hose with holes in it where everything's kind of leaking out. So this is actually causing low blood pressure, which affects the heart's ability to pump blood to vital organs like your brain, your lungs, and your liver. So you can see here on this picture on the right-hand side. And then sometimes small clots can form throughout the body, which also prevents nutrients from reaching vital organs. So some individuals, when they get to this stage, it's also very dangerous because, they may have had an infection that started, we'll use the UTI again as an example. And now all of a sudden, they're having difficulty breathing. Well, what happens is that many times without treatment, they might develop acute respiratory distress. So this occurs when fluid builds up in the tiny air sacs in the lungs. And since the fluid keeps the lungs from filling with enough air, less oxygen reaches the bloodstream. So again, you're depriving organs of the oxygen that they need to function. So it just affects various organs. Kidneys are affected as well. It leads to low or no urine output. Some individuals may have changes in mental status, right? Because their brain is receiving less oxygen. So this is all very, very serious complications if you get to this point. And at this time, many of the clients or patients that have severe sepsis, a lot of them may require treatment in an intensive care unit, right? So that doesn't become worse. So septic shock is when when arteries fail to constrict to maintain an adequate blood pressure. So it's when septic shock occurs. So in this situation, their hypotension or the low blood pressure, it's difficult to reverse it by giving them more fluids and medications to help. And so at this point, it's also very dangerous because it can be fatal, right? Because of these types of complications. And so there's a lot more details and complex things that happen during these situations that we won't get into the nitty-gritty. But as you can see, just looking at the previous slides and the pictures, all of these are very serious and dangerous complications. A lot of the times when clients end up getting hospitalized because they've become septic, they're a lot of the times more severely ill than those hospitalized for other conditions. They may have considerable longer lengths of stay in the hospital. Worldwide, 1/3 of people who develop sepsis, tend to pass away. Many who do survive are left with life-changing effects, such as post-traumatic stress disorder, chronic pain and fatigue. If it got to the point where some of the vital organs were involved, they might have organ dysfunction moving forward, and in some cases, even amputation. So in the last slide, we talked about how when someone has sepsis, the clotting mechanism works overtime, right? So as nutrients cannot get to the tissue, for example, in the fingers, hands, arms, toes, and feet, the body's tissue begins to die at that point. And so in some situations, that tissue may have to be removed because it can cause infection and make it more complicated. So if the area is located and it's small enough, they may be able to just remove just enough to stop the spread. However, if the damage is extensive, then in some cases amputation may need to occur. So these are all very worst case scenarios when sepsis goes untreated or we don't get to it on time. And the hope is that we catch all of these on time or prevent it altogether so it doesn't lead to these very serious complications. So I have another. I'm going to launch this one. Let's see. So this is question 2. And feel free to answer this one. So what are the signs and symptoms of sepsis? So we have high heart rate, fever, shivering, confusion, disorientation, extreme pain, clammy or sweaty skin, or all of the above. Okay, I think most of you responded. Let's share the results. So technically, it's all correct. It's all of the above. As we mentioned earlier, for some individuals, it's the high heart rate to kind of compensate, or shortness of breath if it's, affecting the lungs. For some, it might be fever. Again, keep in mind that sometimes with the elderly clients, that might not be a symptom for them. But in looking at confusion, sometimes you'll see behavior changes as well. Clammy or sweaty skin. So yes, all of those are correct. Here's another question. So anyone can get an infection, and almost, any infection, if left untreated, can lead to sepsis. But who on this list do you think would also be at higher risk? Give it a few more seconds. Okay, let me share. Yes, again, all of the above. Older adults, people with weakened immune systems, their immune system may not be equipped to be able to fully combat an infection. Chronic medical conditions we'll talk about later on, but that can also put someone at risk, right? If someone is, maybe has uncontrolled diabetes, that kind of puts them at risk too. Their immune system may not be equipped to be able to take care of an infection. People who have survived sepsis, yes, and then children younger than 1 are also very susceptible. Okay. And this is just a graph on the sepsis.org website, just as a quick reminder that when it comes to sepsis, remember it's about time. So watching out for temperature, some may be higher, some might be lower, infection, having signs and symptoms of an infection, mental decline, so confusion, sleepiness, if they're difficult to arouse, any severe pain, discomfort, shortness of breath, all of that. If you see any of those symptoms, making sure that an individual seeks urgent medical care. Okay. So next, we're gonna just kind of talk about different conditions that might make someone susceptible of developing sepsis. So we all know that clients we serve are oftentimes at higher risk of developing certain conditions, right? Including infections, which can lead to sepsis. In addition to being at risk for certain conditions, people with intellectual disability or developmental disability, especially those who can't communicate, might not be able to tell their caregivers if they have pain or aren't feeling well. They might not be able to say that their ear or tooth hurts, or it hurts when they need to go use a bathroom or when they cough, which are all possible signs of an infection. Later on, we're going to talk about, skin conditions and how sometimes that can lead to sepsis if it goes untreated. And so we might have an individual who may not be able to verbalize when something is like itchy or hurting, or if they have a break in their skin. Change in mental status, like confusion or sleepiness may not be obvious at first, which is also a possible sign of sepsis. So when they do become ill enough that someone notices it, sometimes the illness has progressed to the point that it's harder to treat. So we're going to touch on several conditions that may put someone at risk of developing sepsis. And please, at any point, if you have any examples or anything that you've dealt with, working with clients or families, please feel free to share. You can use a chat or, unmute yourself too. So we're kind of just going to discuss different body systems and how, how those can put someone at risk in general. So you may recall a few months ago, we did a presentation on aspiration. If you were on here, we kind of talked about that and different risk factors and ways that we can work and help clients so that, there isn't a risk of them aspirating. We discussed the various conditions that can increase the risk of individuals developing a respiratory tract infection, including, accidentally aspirating food or stomach contents into their airway, which can lead to aspiration pneumonia. There's different, you'll see on this list, like anatomic abnormalities, dependency on caregivers for feeding, immobility, all of those put someone at risk already, right? But when someone develops aspiration pneumonia, that can also be very dangerous. And with aspiration pneumonia, as you may recall, it's usually when, gastric or contents or oropharyngeal contents enter their lower pulmonary system, bringing with it, bacteria and potentially harmful substances that don't belong there. So when this comes into the lungs, which shouldn't be there, it can lead to inflammation and infection of the lungs. And if not treated, that can cause severe lung damage and acute respiratory distress, which can lead to sepsis. So earlier we also talked about, I threw out the term acute respiratory distress syndrome, which is an inflammatory lung injury that happens. So not only can, aspiration pneumonia lead to that, but also sepsis from another condition can also lead to this type of injury. So this is just one example of how lung infections can lead to sepsis. There's many other conditions that can lead to complications. You have flu, COVID, pneumococcal disease that can all lead to, lung infections and all of that will progress to sepsis. So it's important that as caregivers, we work with clients and their healthcare providers to develop strategies to help reduce, any risk of developing these infections, whether it's working out in the community or in the group homes, anything that can be done to have protocols in place to help, the individual, especially if you have someone with high aspiration risk. All of that is going to be really, really helpful and beneficial to the client. So that's, one example. Another thing that comes up often are UTIs, right? I think we've either all experienced it or we know someone who has. So a urinary tract infection is an infection in the urinary tract, which runs from your kidneys through their ureter, the urinary bladder, and out through their urethra. So you'll see here on the diagram, a lower UTI, which is a more common type, affects the lower part of the urinary tract. So the urethra and the bladder. And you'll sometimes hear the word or the term urethritis. So that's infection of the urethra. And if the infection is in the bladder, you'll hear the word cystitis. And if the kidney is involved, then it's pyelonephritis. And if the kidney is involved, then you'll hear terms like, oh, it's the upper UTI, as the kidney is the highest part of the tract, as you can see here. So with a UTI, it's most commonly caused by bacteria. So once the bacteria have entered the urethra, the body tries to fight them off. But sometimes the bacteria multiply and can cause infection. And if left untreated, that can spread to the kidney, causing more pain and illness, and then again can develop into sepsis if it remains untreated. So typically the design of the human body makes it so that it's less possible of getting a bacterial UTI, because the infection comes generally from the outside in through the urethra. However, I'm sure there are a lot of people that are more prone to develop these infections. And it can happen either because of how, they're wiping after using the restroom, sexual activity, or just unsanitary conditions. And then there's also individuals that suffer from having what's called a neurogenic bladder, which is the name given to a urinary condition in people who lack bladder control, either due to like a brain or spinal cord or nerve problem. So if an individual has a neurogenic bladder, that also increases the chances of them developing a UTI. And then we also have individuals out in the community that need urinary catheters, right? The tube that drains urine from the bladder. So all of these can increase the risk of infection, as the catheter provides a means for bacteria to more easily travel up the urinary tract. And so just, wanted to focus a little bit on this because I know we hear it all the time about a client developing a UTI or whatnot. So feel free to use a chat box for this, but what are some signs and symptoms if you've ever worked with an individual who has a urinary tract infection? You can either unmute yourself or use a chat box for this.
You can do frequent urination.
Yes. Yes. And then someone wrote down pain when urinating. And frequent urination, yes. Speech. I'm assuming maybe maybe some confusion. The urge to go, but you cannot void, yes. Falls is a big one. Feeling like you need to urinate constantly. Pain. Yeah, so here are just some. You know, in the early stages of a UTI, someone might feel what some of you already wrote down, set in and extreme urges to need to go to the bathroom. Burning, irritation, or pain as someone goes. A feeling of not emptying their bladder completely. Or feeling pressure in the abdomen or even lower back. Thick or cloudy urine. Someone wrote, you know, smell. Sometimes it's smelly, or just has the stronger odor to it. You know, and as the infection progresses, you know, might develop into fever, pain in the lower part, kind of where like the kidneys are located. Someone might have nausea and vomiting, or being really tired, confusion, agitation. You know, we talked about the dizziness, the falling, behavioral changes. You know, and the thing is, sometimes we might have individuals who may not show a lot of these signs, or maybe it's too subtle for us to even notice. And maybe all the symptoms that they have are, you know, all of a sudden they have these behavioral changes or their confusion. So, you know, it's always good to have this checked out. Yes, Paula, someone wrote dark color as another symptom. So, you know, when someone develops a UTI, that's why it's always important to get that treated right away. Especially, you know, we just want it to prevent it from developing into sepsis. Because then when it develops into that, you know, again, it's a high risk of turning into severe sepsis or septic shock. So making sure that gets addressed right away is really important. Okay, let me go to the next slide. Okay, the GI tract. So, again, if you've been attending these monthly, you know that we've also done a presentation on bowel obstruction and just kind of addressed all the risk factors with that. And then you may recall that we discussed various ways our clients are also at increased risk of developing, you know, bowel obstruction, and why it's so important to have protocols in place to prevent constipation, as it, you know, can lead to various complications, including, you know, fecal impaction, the obstruction, which are all very serious conditions. So fecal impaction occurs when there's hard, dry stool that can't pass through the colon or the rectum. And it's a common cause of a GI obstruction and the result of chronic or severe constipation. So this is also an emergency because it requires, you know, for that to be stopped in order to prevent any, you know, blood flow from being blocked, right? Because if that happens, it can cause part of the intestine to die. And then as pressure builds up from the blockage, intestinal bacteria can actually leak into the bloodstream. Again, really, really dangerous. They might be, you know, an individual might be at risk of developing peritonitis, which is an abdominal infection, which again can lead to sepsis really, really quickly. So again, if addressing constipation is super important, because we don't ever want it to get this severe enough that it can lead to a systemic issue. Another thing, when we talked about during that presentation is that bowel obstruction sometimes in some individuals, if it's severe enough, can cause them to vomit and can also cause them to accidentally aspirate the fecal material into the lungs, which again can lead to pneumonia, which we already talked about. So it just can lead to a list of different severe complications. Okay, let me go to this one. So skin conditions are also important to address. With cellulitis, it's a type of infection that affects the skin and the tissues underneath. The bacteria enter the skin through an opening, such as like a cut, a scrape, a burn, or surgical incision, or sometimes even like a bug bite or a sting, if it gets infected. And again, if this type of infection is left untreated, can also develop into sepsis. A lot of the times you'll see this type of infection more commonly seen like in the lower legs, but it can happen anywhere in the body. And so you'll notice, some redness around the area where the bacteria entered the skin, some tenderness, some soreness of the affected area, swelling, blisters. And again, anyone can develop cellulitis, but there are some people that have higher risk than others. Can anyone think of what might make you or make someone more at risk of developing cellulitis? Again, feel free to use the chat box, or if you want to unmute yourself.
I think that some people who are more at risk for cellulitis would be people who have edema in their lower extremities.
Yes, absolutely. We see that quite often. Don't have the circulation moving, or maybe everything's kind of stagnant. They don't move around. So yes, absolutely. Yes, someone wrote down pre-existing skin conditions involving open wounds. Diabetes, that's a big one. People living with infestations, yes. People who have trouble communicating, medications. Yes, those are all examples of what, increasing the risk factors for cellulitis, poor circulation. Yeah, having an impaired immune system, right, might be more vulnerable to contracting infections. Chronic illnesses, someone mentioned, diabetes. Bacteria love sugar. So if someone has their diabetes under control, they might have developed, a scrape somewhere. And, all of that can make them really susceptible to getting infected. And then, a lot of individuals with diabetes are also susceptible to getting sores on their feet and their legs. So that's why it's always a good idea, making sure that they have their feet checked periodically, a podiatrist, or anytime there's anything going on, getting medical attention right away to make sure that it doesn't get worse. Some skin conditions, I know someone mentioned that, someone who has eczema or shingles and develops into, skin condition, making sure all of that gets addressed right away. Okay, and then this picture is just a very simple picture of what cellulitis might look on early on. It's mild, but as you can see, without treatment, it tends to spread. You'll see the redness spread, the worsening pain, more swelling, skin is tight. So just another example. Okay. Pressure ulcers. So this can occur when there's pressure that causes damage to the skin. And there's, 3 primary risk factors to developing a pressure sore. So immobility, not moving around, increased pressure on a section of the skin, and an interruption of blood flow to that area. So we know that one or more, sores can develop if you lie in bed and, don't change positions often enough, or if you sit still for extended periods of time without moving. That can really, you'll see on this, on this picture where there's common sites, right? The buttocks area, up in the shoulders, elbows, head, heels. So those are all common sites of where if someone's, not mobile and can't move around, might, be prone to developing a sore. But, it can also develop in other ways, right? It could be from, if someone's using crutches and they're using it incorrectly, they might develop something, under their arms. If someone uses like a prosthetic device and it's not, it's not the right fit for them, they might be rubbing on their legs or whatever it is and causing some soreness there. It could even be, from our glasses. If the glasses are too tight, eyeglasses, or if someone's using oxygen tubing and that tubing is too tight, all of that, anything that causes just that type of pressure can definitely cause some break in skin. Which is why we always want to make sure, if someone's using devices and all of that, anything like that, that it's, that they're using it properly, and anything to help reduce the chances of any open sores. Because again, any break in the skin caused by pressure, regardless of the cause, can become infected. Common infections related to pressure ulcers include like localized infections, so infections in the mid area, or there's some individuals where it's gotten so bad it can lead to osteomyelitis, which is an infection that actually spreads to the bone. So again, all of these are really dangerous situations that we want to make sure we can take care of sooner rather than later, because the later might be that it develops into sepsis. Okay. Next slide. So dental health. We all know that poor dental health is also a health issue, right? Higher rates of dental cavities and fewer visits to the dentist can contribute to infections. We may not think so. We're like, well, it's just a tooth, it's not a big deal, but infections can develop anywhere. And they can develop anywhere in the mouth too. So in the gums, the lips, the palate, the cheeks, the tongue, or below the teeth. So paying attention to dental health is also essential in preventing these infections. A dental infection within or below a tooth can be caused by, tooth decay, or even like a broken tooth that causes the pulp to be infected. So you'll see like on this picture, on the top left, you see what a healthy tooth looks like. And then in this individual, it developed an abscess. And so at the very bottom, you'll see how that affected, that area of the tooth. Because the pulp, which is the bottom part here, is part of the tooth that contains the blood vessels and the connective tissue and the large nerves. So if an infection occurs, bacteria can actually move out of the tooth to the bone or the tissue below, like you see here on this picture. And it could form, that abscess, and that infection, if not treated, can also spread. So again, we don't want to ignore dental health either, right? All of those can be really, really detrimental to someone's health. So I mean, there's so many different situations and conditions that can lead to it. I just kind of wanted to address some of the more common ones that we might see in our individuals. Sometimes we talked about earlier how urinary catheters, those types of devices can make someone prone to getting infections. Are there any other conditions or situations that you've experienced working with clients that that we didn't really talk about today that you might want to share with the rest of the group? Conditions or situations that led someone to, develop an infection and possibly may have even led to sepsis?
I know that there are some medications that can impact the gingiva of the gums. I haven't seen it happen, personally, but I have heard of people with certain medications they take that can affect the health of their gums.
Yeah. In general, yeah, there's some conditions or even medications where, if we're talking specifically about oral health, might make them not have as much saliva in the mouth. And that can lead to, increase in cavities, because our saliva helps kind of move things around and all of that. And if it's dry and they're not getting proper, oral care, that can definitely increase the chances of someone getting cavities and make, a severe infection. Yes, Catherine, thank you. Someone in the chat wrote, so far, no, but must always be on the alert. Absolutely. Because like I mentioned earlier, sometimes we might have individuals where, especially when they're not nonverbal and can't tell us that something's hurting or something is bothering, we have to look at other subtle symptoms that might clue us into whether there's something else going on. Anyone have any questions or comments? Kind of went through those slides kind of quickly. So if anyone has questions, comments, any stories you'd like to share, we'd love to hear them.
You know what? I do have something that I want to share, and it's something that people might not realize, and something that actually happened to one of my individuals where I used to work. He had a callus on his foot, and we were treating the callus with the doctor's oversight. And in the process of doing that, he developed an ulcer. And he went to wound care, and in the process of getting the ulcer treated at wound care, he developed an osteomyelitis, and he lost 3 of his toes. So it's really important for people to understand how quickly something can really turn into a bone infection, and can result in people losing parts of their body. So it's important to stay on top of that stuff. And it wasn't anything that we did. It was the way that the wound clinic had chosen to treat him, just because was difficult to treat. So it's just something to think about, that things can happen really fast.
Yeah, I worked in an RCFE, and a gentleman had gotten fairly nonverbal, and he was making noises, and they made an appointment for him with the dentist way far out. By the time he got in there, the infection had gone from an abscess, and he had sepsis, and he had a bone infection, and they took the man's lower jaw.
Oh my gosh.
All over a lack of dental care.
Yes. Thank you. I appreciate you for sharing those stories, because it's sometimes you don't think, sometimes we think it's something simple, and it turns out to be something devastating, right? If they don't get treatment right away, or the right treatment, or the appropriate treatment for that. And you just don't know how quickly something can progress. So I think that just kind of reiterates, knowing our clients, getting to know them, and knowing what's their baseline and when they're off, because that might just be the only symptom or subtle symptom that they demonstrate to show that there's something going on and might need further workup. Well, I do appreciate you all joining us today and participating. As always, we will have another call next month, and so just keep an eye on that with the call information. And in the meantime, if you have any questions or anything, feel free to reach out to Jen or I. If there's any topic in the future that you would like someone, to be addressed in future calls, we're always open to listening to those recommendations. And keep an eye out on the YouTube channel. Hopefully we'll have our other videos up soon. But that's just another way, if you have staff that weren't able to attend, be able to attend those in the future. So with that, I think we will end today's presentation, and just again, thank you all for joining us.
Thank you.